2014-15 was a banner year for University of Virginia athletics in numerous ways. Virginia won 3 national championships, 6 ACC titles, and 80% of UVA teams advanced to postseason play, which helped the Cavaliers finish in the top 10 of the Directors' Cup for the second consecutive year. These results wouldn't be possible without the substantial support of many in the university community, including team trainers, physicians, and surgeons that keep Virginia's student athletes competing at the highest levels.
For probably over 70 years now, UVA Orthopedics has been the team physicians for UVA athletics. Team doctor is a very broad term, usually means a group of physicians collaborating with our athletic trainers to provide the highest level of care possible for our athletes so that they can perform at their best, and if they're injured, they receive the appropriate treatment and rehabilitation to help them return as fast as possible to their sport, but as safely as possible.
The level of care that Dr. Schaber and the other UVA team physicians offer has been conditioned by not only years of medical study and training, but by a close-knit relationship with the university. The late Dr. Frank McHugh, founder of the Virginia Sports Medicine program, set the standard for excellence in care.
Dr. Frank McHugh was really the first team physician for UVA athletics, and he was in that role for over 40 years. A true legend who made it a priority that our athletes receive the best care possible, but not just our athletes, anyone who plays sports. You know, he treated every athlete, every patient he took care of like a family member, and that relationship is very special, and it's very ingrained in UVA Orthopedics when we care for all patients, but particularly for our UVA athletes. We have a long history of having a very close relationship with UVA athletics. We trained here under Doc McHugh. We either went here to undergrad and medical school or did our residency training here. We have some very close relationships and ties to the university. We're all Cavaliers. Not only the doctors are part of this team, we have some of the best athletic trainers I feel in the country. And they're sort of the first line. They're always with the athletes, practice in the weight room. Our athletic training staff is just absolutely exceptional.
It's kind of a close collaboration. We kind of reach out to them when necessary, and they're readily available. And they have the strengths in their knowledge base to know the nuances that the student athletes have placed on them, not only as students but as athletes, and the timing issues that it takes to keep them safe and active.
Injuries are a part of competition, and Dr. Schaber and head athletic trainer Ethan Saliba work in conjunction with one another to help Virginia's student athletes recover and rehabilitate after these setbacks.
You have to have a lot of compassion and understanding that these folks work so hard to get ready, and then all of a sudden the road of hard knocks befalls you, and so it's crushing. I'm trying to allay their apprehension, being honest with them, but also, give them a realistic idea while we continue to resume their role back into being a student athlete again.
The injuries always occur at the worst possible time. Joe Harris broke his hand a couple years ago. Danielle Collins had wrist problems that needed treatment right before she won NCAA singles titles. I remember Akil Mitchell broke his hand literally the week before the season started. I mean, the list is very extensive of people that have been injured and required surgery and have gone on to very productive careers after their injuries. Justin, and I remember in particular, it was a challenging time for me. It was a scary time for him and his family. He was obviously a pro prospect, one of the best players in the country. The team was firing on all cylinders. His injury came at an inopportune time, just like most of these injuries do.
When I went up for that floater, that's when it first got hit. It kind of stung a little bit, so I kind of just tried to shake it off. And then the next couple plays later, I tried to drive to the basket, and Terry Rozier smacked down at the ball. And that's when I felt it, and I didn't know what it was. It felt like maybe a jam finger. And halftime came, and we went back in the back, and we x-rayed it. And I found out I was broken in 3 different places. And Dr. Schaber came back and examined it. And I remember when he looked at it, he said, this is pretty bad, but you're gonna be fine. We're gonna take care of you. We're gonna make sure this is good. And instantly I had faith in his ability, Coach Bennett talked to me a lot about how great he was at what he does, and I'm just so thankful and so blessed to be here at Virginia and have the accessibility of Dr. Chhabra.
I attend all the games as well, so I was called down to the training room, so I came down to the training room and examined Justin and was concerned for a fracture. We had x-ray capability in the John Paul Jones Arena, so we got an x-ray, made the diagnosis, and I made the arrangements to make sure that we could get it done as quickly as possible. So he was injured at 8 o'clock at night, and we were in the OR at 7:30 the next morning. I worked very closely with Ethan and our therapists and with Justin, and he was truly he was a great patient to work with, because he really listened and he educated himself, he learned, and whenever he had questions, he would ask Ethan or me, so that we kept his therapy on track.
It's really a treat to be part of the sports medicine staff here at the University of Virginia Athletics, because at all levels they have a strong sense of urgency to take care of our student athletes, and I think that makes our job so much easier and more pleasant.
I truly believe that Ethan Saliba is the best trainer in college basketball. He's helping you with daily life things, he's helping you with medical things. It's so well-rounded that you never know what you're going to get when you walk into the training room. It's not just going to be some treatment. You may sometimes get a life lesson, walk out with a life lesson and 2 bags of ice on your knees. So it's amazing. The people that you're surrounded with here in Charlottesville, they really have a lot of love for everyone, and the care that they show. Words can't explain how thankful I am personally to be a part of it.
That's what I like about working at UVA, is that people really pull together and we take care of our community. You know, this is our family, this is our community, and we pull together when we need to take care of people.